Morning, everyone who's joining. We are going to give a minute for people to join the webinar. As you'd come on, if you'd like, you can drop in your name and where you're coming from in the chat so we can know who's on the line. We're so glad that you're here with us this morning to talk about Kids Count. I'm seeing a note that chat is disabled. Let me take a minute to undisable it. Hang on. Thank you. Okay, give it a try now. Take a minute to drop your name and where you're coming from, and we will see if the chat is on for participants. Yes, okay, great. It's great to see so many people joining from all around the state. We're just going to take another minute for people to join, and then we will dive into the presentation. All right, everyone. I'm going to pass our presentation over to Jamie Jackson, and please feel free to use the chat throughout this presentation to use the Q&A function. And here we go. Thanks for being with us.
Thanks, Jackie. Good morning, everyone. I am Jamie Jackson, interim CEO for the Colorado Children's Campaign, and welcome to the 2023 edition of Kids Count in Colorado. We are so thrilled you are joining us this morning. The Children's Campaign has been proudly producing the annual Kids Count report for 30 years now. We are honored to have you with us today for the release and every day in this work. We hope this report continues to be a useful tool in the essential work you do to make our state a great place to be a kid. The Colorado Children's Campaign is Colorado's nonprofit, nonpartisan policy and advocacy organization focused on the well-being of kids and families. We have been serving the state since 1985 and are proud to champion policies and programs that advance every chance for every child. We are a research and data-driven organization, which is why this Kids Count report is so important to us and why we are so glad so many of you are joining us here today. For those of you who are new to Kids Count work, I'll share a bit of background about the project before our staff dive into the data and policy recommendations. Kids Count in Colorado is part of the Annie E. Casey Foundation's National Kids Count project. The report tracks child well-being at both the state and county levels in the areas of family economic prosperity, child and family health, early childhood learning and development, and youth success. It serves as an important source of quality, non-biased information on children and families for decision makers and child advocates. This year's report spotlights youth mental health, an issue we've been hearing about with increasing urgency in recent years from partners and organizations working directly with kids and their families. It includes an overview of the most recent data on the topic and offers recommendations for policy action to promote youth mental health in the years ahead. We hope the information you hear today will help support your work, and we thank you for joining us in our commitment to ensuring every chance for every child. We want to take a moment to thank our funders who generously support this essential report. The 2023 edition of Kids Count is made possible through the support of the Annie E. Casey Foundation, the Ann Schutz Foundation, the Buell Foundation, the J. N. Rose Phillips Foundation, and the countless contributors whose investments make possible the work of the Colorado Children's Campaign, including those who share critical data. And if you're hoping to get a physical copy of the report, there's no better way than by joining us at our annual event. The Connection reception is on September 20th. Tickets are available now. It's an important way to support the work of the Children's Campaign and to connect with our team and with each other. We'll drop a link to the tickets in the chat. We definitely hope to see you there. Now I'm going to turn it over to our Director of Communications, Jackie Zubricki.
Great. Hi again, everyone, and thank you, Jamie. I'm Jackie Zubricki. I'm the Communications Director at the Colorado Children's Campaign. I want to share a few things before we get started. So for those of you who are familiar with this report, you know that the report itself includes a lot of data we won't have time to feature here, including county profiles for each county in the state and profiles of promising practices across Colorado. We will send a follow-up email after the presentation with a link to the report on our website. It's also going to have other ways to order a physical copy of the report and how to get in touch with us if you'd like to schedule a presentation of Kids Count data at your organization or in your community. So keep a lookout for that, and we'll drop some information in the chat as well. I see people are already doing this, which is great, but please use the chat feature throughout this if you want to offer comments or to share with one another. And you can use the Q&A feature of the webinar to submit questions about the data to our team. We are going to answer questions throughout the presentation, and we'll also pause twice to have a chance for people to unmute and ask questions. If you would like to ask a question and unmute yourself and share, please note that in the question that you submit. So we want to use the Q&A feature. We want to unmute you all and hear directly from you, but we'd like you to submit those questions first and flag for us if you'd like to share. And please know that you're always welcome to get in touch with our team if you have any questions about the report or the data. I want to introduce Erica Manawaddle. Erica helped put this presentation together, and she's going to be helping answer questions. So you'll see her name in the chat. I want to give her a chance to introduce herself. So Erica, can you say hello?
Hi, good morning, everybody. My name is Erica Manawato. I'm the owner of Nested Data LLC, but I see so many familiar names, and you might recognize me because prior to this, I worked for the Children's Campaign as their manager of research initiatives. So today I'm here helping them with the presentation, but also here to answer questions like Jackie said as we walk through the data this year. So thanks for being with us today.
Awesome. Thank you, Erica. And just one last slide before we dive into the data. This year's presentation and Kids Count always includes wide-ranging data that spotlight issues that matter for kids and families. But at the Children's Campaign, we know that young people have their own perspectives and insights into what's happening in their communities that can often tell us as much as any data. So we were excited this year to partner with the Youth Scan project to include youth voice in the Kids Count project. You will see quotes throughout today's presentation and throughout the report. These are direct quotes from young Coloradans who participated with YouthScan to share about issues they're concerned about in their communities, like social isolation, the environment, or gun violence. And youth also share ideas they have about how to address those issues. So you can learn more about YouthScan at youthscanproject.org, and we are really appreciative that they partnered with us to share their important data to complement the data that our research team pulled together for this report. And with that, I'm going to turn it over to Charlie Barraza to dive into the data. Please remember to ask questions as you go and flag for us if you'd like to ask that question during one of our pauses for questions and answers. All right, thanks, Charlie.
Good morning, everyone. I'm Charlie Barraza, the Advocacy Manager for the Colorado Children's Campaign. As an immigrant and someone who went through 8 different educational institutions before I was 18 years old, I've seen how important mental health and social-emotional learning are to students, teachers, and the wider community who benefit from being able to provide the best services for youth versus when youth aren't provided proper assistance and support or are forced to navigate growth and development seemingly alone. We hope this data and trends help to align how best we can support our youth in the critical time, not just for their development, but our society as a whole, thanks to the pandemic and online connectivity. Before we proceed, I want to provide a heads up that today's presentation will discuss mental health struggles and suicide. This data and context can be difficult to digest, but we think is immensely crucial to understand so we can make the right policy changes that will ensure all Colorado youth are able to thrive. If you or someone you know is in crisis and in need of immediate support, you can access free confidential help through the Suicide and Crisis Lifeline by calling or texting 988. Help is available 24/7 in English and Spanish. Now let's dive into some of the data on youth mental health. Nearly every source of data on Colorado youth has found concerning increases in mental health struggles in recent years. The Healthy Kids Colorado survey found that the share of high school students reporting persistent sadness or hopelessness, a sign of clinical depression, soared to 40% in 2021, up from 24% in 2013. That data is seen here in red. Youth from groups that have historically faced bias, discrimination, and oppression, including girls and some groups of students of color, and especially those who identify as LGBTQ+, are more likely to report these feelings. Additionally, in 2021, 1 in 6 high school students reported that they hadn't seriously considered attempting suicide in the past year. Not a significant increase from 2013, but still a significant share of young people. This data is available in purple. Between 2016 and 2021, the number of mental health related ED visits by Colorado kids under 18 more than doubled, from 1,655 visits to nearly 4,000 visits, which you can see in the red. In comparison, mental health related visits for adults increased by only 23% in the same time period. Further, the number of emergency visits for self-harm among Colorado kids more than tripled in just 5 years, as you can see in purple. Emergency departments are not equipped to provide comprehensive mental health treatment. Yet in the absence of high-quality, accessible mental health care in many communities, they have increasingly become places where kids, teens, and their families are seeking support for serious mental health challenges. This data shows an urgent need for accessible mental health care options for youth that can support them before they reach a point of crisis. In 2022, 56 Colorado teens and 17 Colorado children lost their lives to suicide. While each of these deaths was a tragedy, the state's teen suicide rate improved overall in 2022. The suicide rate for 15 to 19-year-olds in Colorado, seen in red, dropped from 20 per 100,000 teens in 2021 to 15 per 100,000 teens in 2022, the steepest decline in many years. For children between the ages of 10 and 14, which you can see in purple, the rate stayed about the same last year as compared to 2021. The decline among older teens is a win for our state. Still, this only represents an improvement over 1 year. So it's critical that Colorado keeps up the momentum on recent efforts to prevent suicide among young people. The rate from recent years indicate that suicide among teens and children is much too common overall. Suicide deaths are more common among some groups than others. Although girls are more likely to report considering suicide, boys are much more likely to die by suicide, likely because they tend to use more lethal methods such as firearms. Between 2018 and 2022, 333 suicide deaths among Colorado youth occurred among boys between the ages of 10 and 19, representing more than 70% of deaths in this category. During the same time period, firearms were responsible for nearly half of all suicide deaths among adolescent boys, compared to less than a quarter of deaths among girls. Inadequate mental health care is further driving this crisis among Colorado youth. Provider shortages are a significant barrier for Colorado youth seeking mental health treatment. This year's report dives into a first-of-its-kind data from the Colorado Department of Education on school mental health professionals in districts across the state. And the data shows that access to school-based mental health providers is far too limited in many Colorado communities. At the beginning of the 2022-2023 school year, Colorado school districts reported approximately 278 vacant positions for school psychologists, school social workers, and counselors. By the end of the school year, nearly 60% of these positions were still not filled. In contrast, only 9% of teaching positions open at the start of the school year remained vacant. In the chart above, you can see the data disaggregated by position type. Throughout that year, 72% of school psychologist positions remained unfulfilled, along with 62% of school social worker positions and 51% of school counselor positions. School-based mental health provider positions were especially difficult to fill in rural and small rural districts. Diving specifically into school psychologists, the ratio of Colorado preschool to 12 public school students to licensed school psychologists in the 2022-23 school year was 928 to 1, nearly double the 500 to 1 ratio recommended by the National Association of School Psychologists to ensure these professionals have the capacity to effectively meet student needs. In 113 of Colorado's 178 school districts, including many where counties have higher suicide rates in the state, there were no licensed school psychologists employed by the district. At settings where many children spend most of their waking hours, schools play an important role in connecting students to mental health resources. Colorado leaders must prioritize strategies to bolster the school-based mental health care provider workforce and ensure schools can attract, retain, and adequately compensate mental health professionals, particularly in rural areas. As you can see in the screen, here's just one example of the kind of insights we can glean when we center youth voice and perspective, something we think is crucial in developing and implementing policy that impacts Colorado youth. Due to the convergence of the pandemic, accessibility of social media, and online interconnectivity is so important that we listen and work with youth to understand how these circumstances affect them and how we can work together to ensure all young people feel heard, supported, and able to thrive. You can read more about students' experience and react to these issues, as well as potential solutions they offer in the full report. Youth mental health is a deep challenge with a lot of potential solutions. It will take all of us to work together to ensure all young people feel safe, supported, and able to thrive in their community and in Colorado. We have some research-backed strategies that Colorado can pursue to promote mental health among kids, teens, and families, but we also encourage you to provide your thoughts and ideas in the chat as well. We wholeheartedly believe there needs to be a focus on mental health of young children, which will help them develop important coping and emotional regulation skills that they can rely on throughout their lifetime. This means ensuring connection and trust, not just between the child and their family or school, but also ensuring there's opportunity for safe and effective interpersonal development between youth inside and outside the school setting. With family support, such as direct cash assistance, affordable housing, high quality school meals at schools, or fair wages for workers, we can create a system that supports all families to be able to meet their basic needs, and therefore provide a nurturing environment that ensures all children are able to learn and thrive. We need a strong focus on school climate, ensuring our public school system is able to create a safe learning environment through relationship building, opportunities for social emotional learning, and mitigating risk factors for mental health struggles. Children and teens are the experts in their own lives, with unique insights into their communities and how the pandemic and social media are directly impacting their lives. Adults should make a genuine effort to connect with them, center their experiences and ideas, and give them agency over decisions that affect them when possible. Now, I will pass it to Sarah Barnes, our Senior Policy Director, to discuss data and trends on family economic prosperity. Thank you.
Thank you, Charlie. And thanks everybody for being here today. I'm excited to be able to share some of our data from the report on family economic prosperity. My name is Sarah Barnes, and I'm the Senior Policy Director at the Colorado Children's Campaign. We know that economic security is foundational to child well-being, but too many Colorado kids are living in families who are struggling to make ends meet. In 2021, nearly 1 in 8 Colorado kids, or 12%, experienced poverty. And this is defined as having an annual income below $26,500 a year for a family of 4. You can see this represented on the chart in green. Although this was not a significant increase from pre-pandemic years, it's still unacceptably high in a state that has so many resources. This figure represents approximately 145,000 children in our state who live in poverty. Of these 145,000 kids, about half, or 72,000, experienced extreme poverty, which is defined as having an annual income below 50% of the federal poverty level. This translates to having less than $13,250 per year in annual income for a family of 4. Although Colorado's overall child poverty rate sits well below the national rate of 17%, which we saw in the last slide, we know that some communities in our state have child poverty rates that are more than twice the national average. Costilla County had the highest child poverty rate in our state in 2021 at 36%. Douglas County had the lowest child poverty rate in our state at only 3%. We also know that children of color are much more likely to live in poverty due to a history of policies that have limited opportunity for families of color. Between 2017 and 2021, poverty rates for American Indian or Alaska Native children and Black or African American children in Colorado were triple the rates for white children. The poverty rate for Hispanic or Latino children in our state was more than double the rate for white children. These disparities are unacceptable, and Colorado must prioritize efforts to ensure that families of all races are able to access the economic opportunities they need to meet their basic needs and to thrive. The 2023 report also dives into cost of living, housing, and homelessness among Colorado families, as a stable place to call home is an important driver of child well-being. The pandemic exacerbated Colorado's pre-existing affordable housing challenges, leaving too many families without secure housing. In 2021, 3 in 10 Colorado kids lived in households that were housing cost burdened, which is defined as spending more than 30% of your monthly income on housing costs. Among low-income households, nearly 7 in 10 children were living in housing cost burdened homes. And 1 in 10 kids in Colorado lived in crowded housing, which means that they had more than one person per room in the home. The good news is that economic opportunity is shaped by policy choices, and state and federal policymakers can help families access everything their children need by investing in public programs that are proven to improve families' financial security, and in turn, their overall well-being. A 2022 study found that public programs such as the Child Tax Credit, SNAP, school lunches, and housing subsidies continued to keep millions of American children out of poverty in 2021, despite the continued economic challenges of the second year of the pandemic. Specifically, the refundable child tax credit helped to prevent 2.9 million American children from falling into poverty. Temporary expansions to the child tax credit that were made in response to the pandemic cut child poverty in half in 2021. Yet, Congress let those expansions expire in December of 2021, sending millions of US kids back into poverty. In Colorado, we also know there are policy solutions that can help improve families' access to economic opportunity and prosperity. We should get money back into the pockets of families, which can help them meet their basic needs and support their health and well-being in a variety of ways. Strategies to do this include tax credits like the child tax credit and the earned income tax credit. It also includes basic cash assistance through our TANF program for families who are experiencing extreme poverty. And it includes direct cash assistance policies like guaranteed income programs that help families get closer to having an adequate income to thrive. We should also make improvements in the way that programs serve families and ensure that we center family voices in identifying and designing those improvements. And lastly, we should promote housing stability for families by preventing families from being evicted from their homes. Strategies to do this include ensuring adequate legal supports for families who are at risk of eviction, and improving data collection to identify our state's eviction trends. And now I'm going to turn it over to Jackie for a brief Q&A.
Hi, everyone. So if you have any questions about the data that Charlie or Sarah just shared, take a minute to drop those in the Q&A or in the chat. I see we've had a couple specific questions come up, but haven't had anyone flag that they want to unmute, which is fine, but I will give a minute or two for folks to drop in questions about either that youth mental health data or the data on family economic prosperity. So we'll have another pause after the next few data sections. So if you do have another question that you'd like to share, drop it in and we will have plenty of time for questions a little bit later on. I think for now, while people are still thinking of their questions, we'll keep moving along with our presentation. So I am going to pass it over now to Hunter Nelson, and Hunter's going to share some data about our health on policy data. And I do see some of these questions trickling in now, which is great. We'll save those and we'll address them in our next Q&A section. So keep them coming. Thanks.
That's good. Thanks, Jackie. Hi, everyone. I'm Hunter Nelson. I'm a senior policy analyst here at the Colorado Children's Campaign. And I'm going to share some of the Kids Count Report's analysis of data and trends in child and family health. So a bright spot in this year's data was a decline in the uninsured rate for Colorado kids in 2021. The share of Colorado kids without health insurance fell from 5.5% in 2019 to 4.6% in 2021, represented in green on the slide, reflecting 12,000 fewer children without health coverage. Why is this, you may ask? If you know the answer, if you're a policy nerd like we are, put it in the chat. As this improvement in the uninsured rate amid the COVID-19 pandemic may seem counterintuitive given the economic turmoil that was caused by the COVID crisis. I see it, yep, I see Jamie Rodriguez put in the chat, thank you. Yeah, I'll give it a couple more seconds. You have 3 more seconds to put the answer in the chat if you know it. 3, 2, 1. Well, Jamie got it right. It is the a federal policy change that it was enacted during March 2020, known as the continuous eligibility provision or continuous coverage, drove the decline in the uninsured rate and helped tens of thousands of Colorado kids keep their health coverage. The continuous eligibility provision barred states from disenrolling anyone from Medicaid or the Children's Health Insurance Program, CHIP, while the public health emergency was in effect, unless they voluntarily disenrolled, died, or moved out of state. This change was designed to prevent the temporary loss of Medicaid or CHIP coverage that many people experience during a typical year for reasons unrelated to eligibility, including difficulty navigating the renewal process, temporary fluctuations in income, or not receiving a renewal notice. This provision ended earlier this year, allowing states to disenroll people from Medicaid and CHIP for the first time in 3 years. Children are expected to be impacted disproportionately, with the U.S. government projecting that more than 5 million U.S. children will lose their Medicaid coverage. An estimated 3 out of 4 of these children will lose their insurance due to administrative paperwork issues and procedures. In May 2023, the Colorado General Assembly passed a measure to provide Medicaid and Child Health Plan Plus, CHIP Plus coverage continuously for children birthed to age 3 by 2026. But without additional efforts to help families renew their Medicaid coverage or connect them to other sources of insurance, the number of children without health insurance is likely to increase dramatically in the years ahead. However, the provision ended earlier this year, as I mentioned before on the previous slide, allowing states to disenroll people from Medicaid for the first time in 3 years. And here in Colorado, as of May of this year, more than 1/3 of Coloradans who have lost Medicaid or their Child Health Plan Plus coverage are for procedural reasons were children under the age of 18. Among all ages, Hispanic and Latino Coloradans have been disproportionately likely to lose public health coverage due to procedural reasons during the unwind. So just highlighting that we are seeing these trends here in Colorado. As mentioned in the previous slide, much of our state's success with the uninsured rate is due to publicly funded health insurance programs, such as Medicaid and CHIP Plus, which cover more than 500,000 Colorado kids each year. In fiscal year 2021 to 2022, nearly 618,000 Colorado kids, 47% of children ages birth through 18, were covered by Medicaid at some point, while nearly 4% of Colorado kids, nearly 50,000 children, were covered by the Child Health Plan Plus. The continuous eligibility provision drove the increase in the number of kids covered by Medicaid between fiscal year 2019 and fiscal year 2021, excuse me, helping more kids access essential services during an economically tumultuous period. So this year's Kids Count report also includes information on maternal health in Colorado, much of which is troubling and exemplifies the maternal mortality and morbidity crisis in the United States, which is the worst of industrialized nations. Unfortunately, Colorado has seen a sharp increase in the maternal mortality rate since 2018, prior to the pandemic. In 2020, the rate of pregnancy-associated deaths was 68 per 100,000 live births, representing 42 birthing people who died while pregnant or within 1 year of their pregnancy. Pregnancy-associated deaths include all deaths that occur during pregnancy or within 1 year of the end of pregnancy, regardless of the cause of death. Pregnancy can end by live birth, stillbirth, fetal death, miscarriage, or abortion. The data show that in just 2 years, Colorado's pregnancy-associated mortality rate rose by nearly 50%. The majority of these deaths have been deemed preventable by the state's Maternal Mortality Review Committee. The rising number of maternal deaths points to an urgent need for better support for pregnant and postpartum moms and birthing people in our state. Biased treatment within the healthcare system and large-scale inequities in U.S. society have created unacceptable inequities in maternal mortality rates. As shown in this bar graph on the slide, in Colorado, American Indian and Alaskan Native and Black birthing people were significantly more likely to die during pregnancy or within 1 year postpartum between 2016 and 2020 than the overall population giving birth. Struggles with mental and behavioral health continue to drive maternal deaths. Suicide and accidental drug overdoses were the leading causes of pregnancy-associated deaths in Colorado between 2016 and 2020, as you can see on the slide. Together, these two causes were responsible for nearly 40% of maternal deaths during this time period. indicating a crucial need to improve social support for new parents and remove barriers to behavioral health screening, follow-up, and treatment. This year's report also includes data on the leading cause of death among U.S. children, firearms. So I want to take a minute to acknowledge the sensitivity of this subject matter, the trauma that gun violence causes for communities. And I want to pause for a few seconds in remembrance of the lives lost to gun violence. Thank you for that. In 2021, the number of Colorado kids and teens killed by guns reached its highest level in the last 2 decades, with 83 young lives lost. More broadly, firearms surpassed motor vehicle crashes to become the leading cause of death for American children ages 1 to 19 for the first time on record. Between 2019 and 2021, the number of gun deaths among American children increased by 50%, bringing the number of U.S. kids and teens killed by guns in 2021 to its highest level since the CDC began publishing mortality data for children under 19 in 1999. Both homicide and suicide firearm deaths among Colorado kids and teens doubled over a longer time period, between 2000 and 2021. In 2021, approximately 48% of all gun-related deaths among youth in Colorado were homicides, which is represented in blue on the slide. 47% of gun-related deaths were suicides, which are represented by yellow, in yellow. Firearm deaths due to other causes, such as accidental firearm discharges or undetermined intent, made up the remaining 5% of gun-related deaths, which is represented in gray. These numbers point to an urgent need for policy change to prevent children from accessing guns without adult supervision and to bolster gun safety laws that protect children from firearms in their homes, schools, and communities. And this is exemplified through one of the quotes from a youth themselves from the Youth Scan Project. A student reported, "Gang violence has affected me personally. It's prevalent in my school and in my community, and I'm tired of seeing people be hurt." And a student also offered a solution: creating a sense of community with community-led projects, creating spaces for younger, lower-income youth, and involving more social emotional learning in schools. So some policy recommendations based on the data we shared here. As shown by the data presented, a concerning percentage of Medicaid and Child Health Plan Plus and disenrollments in Colorado thus far have been due to procedural reasons. We need to take steps to reduce administrative burdens for children and families moving through the renewal process, including the state maximizing the flexibilities available from the federal government to mitigate procedural disenrollments. We have also had many great laws passed in Colorado in recent years to improve and expand access to healthcare coverage, and we need to make sure these are implemented equitably. This includes establishing a special enrollment period for pregnancy beginning in 2024, expanding Medicaid and Child Health Plan Plus to pregnant and postpartum Coloradans and children regardless of their documentation status in 2025, and implementing Medicaid and CHIP Plus continuous coverage policies for Colorado kids and families beginning in January of 2026. We also need to expand access to racially and culturally diverse healthcare providers. Studies have shown that when there's cultural congruency between a person and their healthcare provider, such as a shared racial identity, this can lead to better health outcomes. Also, access to doula and midwifery services has shown to produce positive birthing outcomes, especially for Black and Indigenous birthing mothers and people. Health carriers should reimburse doulas and midwives equitably and at rates commensurate to the critical services they provide. We also saw the passage of multiple evidence-based gun violence prevention laws in Colorado this past session, including raising the minimum age to purchase a firearm, establishing a 3-day waiting period for purchasing a firearm, and expanding who can file extreme risk protection orders, otherwise known as ERPOs. We need to ensure that these laws are implemented with fidelity and adequately enforced so we can reduce rates of gun violence in communities and prevent youth suicides. So now I'm going to pass it to my colleague, Lauren Corboy, to discuss data and trends related to early childhood in Colorado.
Thanks, Hunter. Colorado kids, families, communities, and employers all rely on childcare, but due to insufficient public investment in childcare, the current landscape is not working well for the vast majority of people. My name is Lauren Corboy, and I am an early childhood policy analyst at the Colorado Children's Campaign. Across Colorado, the need for childcare continues to outpace supply. Colorado's licensed childcare centers, family childcare homes, and preschools have capacity to serve just 2/3 of the children estimated to need care based on labor force participation among families. Some families may prefer care provided outside of a licensed setting, often referred to as family, friend, and neighbor, or FFN care, which also serves as a vital care setting. But data suggests that regardless of care setting, too many Colorado families still struggle to access the care they need. Licensed capacity in Colorado's childcare centers, family childcare homes, and preschools is insufficient to meet the needs of the estimated 232,000 children under 6 who need care. In 2021, 66% of those children were able to be served by licensed slots, here on the slide in dark purple, leaving 34% without access to a licensed slot in light green. Among the 27 Colorado counties for which data were available, median wages for childcare educators range from $27,787 in Mesa County to $35,574 in Pueblo County. Wages for childcare educators are also very low in comparison to other education occupations in Colorado, and the gap is only widening. In 2021, the median age for a childcare educator was only 84% of what a typical preschool teacher earned, and only about half of the wages for kindergarten teachers and other elementary school teachers. An analysis by the Center for the Study of Childcare Employment at UC Berkeley found that 15% of early educators in Colorado were living in poverty, compared to just 2% of K-8 educators. Further investments in our state's childcare educators is an essential step to making enough care available to families. In 2021, 46% of Colorado 3- and 4-year-olds were enrolled in preschool, according to information reported by families or caregivers on the U.S. Census Bureau's American Community Survey. Preschool enrollment in Colorado was significantly lower in 2021 than in 2019, when 52% of young children were enrolled. This trend suggests that the COVID-19 pandemic impacted preschool participation among Colorado's youngest children. Among counties with available data for 2017 to 2021, preschool enrollment among 3- and 4-year-olds ranged from as low as about 1/3 of young children in some counties, including Conejos, Albert, Grand, and Washington, to between 66% and 86% of children in others, including Boulder, Costilla, Huerfano, Clear Creek, Routt, Pitkin, and Gunnison. In fall 2022, the share of Colorado kindergartners meeting age-level expectations for school readiness varied by domain. About 3/4 of kindergartners met expectations in cognition and literacy, while about 2/3 met expectations in mathematics. 72% of children met expectations in physical and motor development, while 71% were proficient in language and social emotional development. So let's dive into some policy recommendations for all the data we just discussed. First, we need to keep monitoring and evaluating the implementation of the Colorado Department of Early Childhood and our brand new Universal Preschool Program, or UPK, to ensure continued growth and success. Next, we should focus efforts on creating an integrated and streamlined birth through 5 early childhood system that supports infant and toddler childcare, including increased funding for compensation and licensing support to avoid potential unintended consequences of expanding access to preschool. Childcare in Colorado, and indeed nationally, is chronically underfunded. We recommend increasing public funding for this space in order to ease the financial burden on families and providers alike. It's time to increase our public investment in this essential public good. We know that early childhood providers are the backbone of the early childhood system. We must prioritize both recruitment and retention in this workforce, making significant long-term investments to increase compensation, benefits, and support for providers across all care settings in our mixed delivery system, including for family, friend, and neighbor or FFN providers. And lastly, Colorado must be able to measure its progress toward a more equitable early childhood system in real time. This means building a comprehensive and publicly available early childhood data trust. And with that, I'll pass it to my colleague, Melissa Mattis.
Thank you, Lauren. Hi, everyone. My name is Melissa Mattis, and I'm the Director of Early Childhood Initiatives at the Colorado Children's Campaign. And I'm happy to be presenting our youth success data today. To align with our new strategic framework that includes a focus on youth success, both within and outside of an education system, this year's Kids Count report includes data on educational outcomes for Colorado kids and youth, as well as other indicators on how youth are faring that go beyond educational settings. In 2021 to 2022, more than 1/3 of Colorado students, or 36%, were chronically absent, a sharp rise from 26% the previous year. Chronic absence is defined as missing at least 10% of the school year for any reason. Rates of chronic absenteeism varied widely between districts. For example, fewer than 5% of the students in the Idalia and Vilas school districts were chronically absent, where nearly 70% of students in Costilla County Centennial school districts were chronically absent. COVID-19 related quarantines may have contributed to this spike in absence, given the very high number of COVID-19 infections during this time. Regardless of what drove the increase, we know that a significant share of Colorado students missed valuable learning time during this period. Luckily, we also know that school climate can play a role in improving chronic absenteeism and other negative outcomes for school-age kids. Research has found that a positive school climate is linked to an array of benefits for children and youth, including a decrease in rates of suspensions and expulsions, improved academic outcomes, and higher graduation rates. So from left to right on this slide, you see some really striking statistics from the Healthy Kids Colorado survey. For example, 59% of high school students reported their teacher notices when they do a good job and lets them know about it. 47% reported that their school lets their parents or guardian know when they have done something well. 37% reported that they enjoyed being in school most of the time or always in the past year. Unfortunately, 11% reported being bullied on school property in the last year. However, that's down from 17% in 2019, so trending in the right direction. 10% reported being bullied online in the past 12 months, also down from 13% in 2019. And then 10% reported they did not go to school at some point in the last 30 days out of fear for their safety. We're really excited to share that as a result of House Bill 22-1376, the Colorado Department of Education will soon be required to collect and publish comprehensive data on indicators of school climate, which will help advocates better understand the experiences of Colorado youth at school. Our youth success section also includes data on substance use among Colorado youth. While some types of substance use among teens have decreased in recent years, including alcohol, tobacco, and marijuana, the illicit use of prescription pain medications and deaths due to accidental overdose are unfortunately stagnant or increasing. In 2021, more than 1 in 7 Colorado high school students reported having taken prescription pain medication without a doctor's prescription 1 or more times. And unfortunately, after spiking during the first year of the pandemic, the number of deaths due to accidental or unintentional drug overdose among Colorado 15 to 24-year-olds more than doubled between 2019 and 2020 and continued to climb in 2021 to 169 deaths. Deaths due to synthetic opioids, including fentanyl, have driven much of the increase in recent years. At this point, I'm really happy to share another youth scan quote. The student reported issue is vaping and substance abuse being very common among youth, a little too common. A lot of youth turn to these alternatives as options of escape from situations in their lives. Most tie back to mental health. The student offered solution is, quote, give you space to talk about issues without punishment, then you will find answers. People should really take the time to bond with youth, not just for brief, meaningless conversation. I think it's really compelling hearing from youth in their own words. Aside from a slight dip in 2021, we do see that our on-time high school graduation rate has seen a steady climb since 2010. In 2022, Colorado's on-time high school graduation rate, which is defined as the percentage of students graduating within 4 years, increased slightly to 82.3%. We know a high school diploma can ensure several important outcomes for young people down the line, including economic prosperity. For example, in 2021, Coloradans with a high school diploma earned 22% more than those who did not finish high school and were half as likely to experience poverty. Now, although we see the on-time graduation rate increase slightly on the last slide, year-to-year changes continue to differ across racial and ethnic groups of students. This slide shows that American Indian and Alaska Native students, Native Hawaiian and Pacific Islander students, and students of 2 or more races saw drops to the on-time graduation rate. It's very important to note, however, that our state's cohort of Native Hawaiian and Pacific Islander students is very small, fewer than 200. The small changes in the number of students graduating on time will cause large year-over-year changes in the graduation rate, and that's why that large bar facing downward on this slide that you see looks so large. Still, graduation rates increased in 2022 for many student groups who have historically faced the most barriers to educational opportunity. Among many groups that saw large increases, students who qualify as Title I saw a nearly 3% increase in the rate of on-time graduation. So with that, I'm happy to share our policy recommendations for youth success. We're really thrilled to have succeeded at many recent policy wins and recommend that we really keep an eye on that implementation process to make sure that we enact a new, more accurate and holistic measure of students experiencing economic disadvantage so that we can better fund schools and better serve those students. We also recommend that the state invest in addressing disparities between low and high wealth districts to correct for continued educational inequities. And finally, as you've seen throughout this presentation, we're strongly in support of youth leadership models and recommend that they be bolstered and scaled. And lastly, we recommend providing fentanyl test strips, Narcan, and substance abuse and misuse trainings in schools as one strategy to address the tragic rising number of accidental overdose deaths among youth. With that, I'm happy to pass it back to Jackie for any questions and updates.
All right, thanks everyone. So we covered a lot of topics and a lot of ground here, and I've seen some really great conversation in the chat. And so please, if you have questions that you haven't asked yet, now is a great time to add them. We'll spend about 10 minutes on questions now, and we'll likely wrap up our presentation a little bit early. I'm going to go back up to the chat and surface some of the questions that came up here that I think others might be interested in, just to make sure if you're not following the chat that you saw this. So I know that earlier on, Mary asked about some policy ideas to ensure that benefit programs are meeting families' needs. And Sarah Barnes, I saw that you answered Mary's question. I'm wondering, could you unmute and share some of the strategies around family economic prosperity to make sure that benefit programs are actually meeting families' needs?
Yeah, of course. I mentioned a few strategies in the chat, but I think in many ways it's thinking about our public benefit programs and centering families' perspectives and voices in those conversations to understand how public benefit programs actually work for families and don't work for families, and just how to make them more nimble and responsive to living in our state today, taking into account the cost of living that's very high, as we know, and we saw a lot of those data today, and there's data about that in the report. And then thinking about how some of our public benefit programs are outdated in the ways that they think about what families need to meet their basic needs today, and how those programs need to shift, what sorts of requirements programs put on families, and how those work, and how those may need to be reconsidered as well. So I think those are just a few of the strategies that we are thinking about and hear about when we talk with families.
Awesome. Thanks so much, Sarah. So switching to the data on access to mental health professionals in schools. So we had just a specific question that I think might be helpful to clarify, that was around the regional data. Jamie asked in the slide about school psychologists, which I can surface again here, when it says in those rural areas where there are no school psychologists employed in a district, does that mean that every district in the county didn't have one, or just one? So that's just a specific data question that I'm going to bring us back to. And Erica, I'm wondering if you could help people understand how to understand this map showing these big gaps.
Yeah, for sure. So the districts in red, and you can see the sort of district lines that are in gray, those are places where there was no licensed school psychologist that was directly employed by the district. You'll see a note at the bottom that speaks to the question too. The students in those districts, it's possible they had access to a school psychologist through their Board of Cooperative Educational Services, or their BOCES. But even if they did have access to their BOCES, we can say that the access is still extremely limited. So the map just represents sort of their access within their school setting, within their school district. It's possible some of the kids in those districts were still able to access someone, but still the ratio is not good in those places.
Awesome. Thanks, Erica. We had a question that I will read just because I wonder if other people who are on the chat right now might know more than we do. April asked if there are any grad school programs in the works so we can get more school counselors or school psychologists hired in the future. So that's something that we can look into on our team. But if you know about different pipeline programs or efforts to address this map that we're looking at here, please feel free to drop them in the chat as well. And I will flag, I put a link in the chat earlier, but you can find the report on our website. It is up and published right now. And it will have a lot of the data that is shared in our slides. And a few people asked if this presentation is being recorded. It is being recorded. We'll send out a link to it, and the slides will be available on our website by the end of this week as well. Looking to see if we've got any open questions that we haven't addressed. Children's Campaign team, are there any others up here that you'd like to make sure that we answer?
Hi, Jackie, it's Melissa. I see Elena Rosenfeld. I see your hand is raised. Do you have a question for us?
Elena, I can unmute you now and I'll allow you to talk if you still have your question. Can you raise your hand again, Elena? Okay, Elena, here we go. You should be allowed to, okay, there you go.
Yes, thank you very much. And honestly, I hit the raise hand by accident, so that's embarrassing. But I've been very intrigued with the survey for youth success, and the fact that I've heard in our area a number of schools, because they were uncomfortable with the survey questions, were not distributing it. And I was wondering if that was a local thing or something that people from other parts of the state are aware of.
That's a great question. I'm wondering, Erica, I was just going to ask if you're able to respond to that.
Yeah, I was chatting with Elena. We do know that, so the healthy kids, those school climate data, as well as actually the symptoms of clinical depression data that you saw at the beginning of the presentation, and the suicidal ideation among teens, and then a bunch of other things that we feature in the report. All of those come from the Healthy Kids Colorado survey that is administered by the Colorado Department of Public Health and Environment, and it was developed off of the Youth Risk Behavioral Survey, which is the national sort of adolescent health survey. But yeah, so Elena and I were talking about schools have to opt in to the Healthy Kids Colorado survey in order for their students to take it. And in recent years, high school sample has been large enough so that the results of the survey are representative of the state. So most years that's true. But it really is dependent on participation. And we know that in certain parts of the state, in the last couple years, there's been some movement away from taking or administering the survey to kids. The survey is also, there's a version of it that's given to middle schoolers, and students in middle school can, middle schools can also opt in. Or I'm sorry, I'm seeing Evie's comment in the chat. You're right, they opt out now. The middle school participation has never been enough for the results to be representative for the state. And so the takeaway here is just the strength of our ability to use those data. And these are self-reported data from young people, high schoolers or middle schoolers. And they're telling us about lots of different things, like how they feel every day going to school, if they feel safe, how they feel in their learning environments, how they feel mental health wise. They're telling us about their school climate overall. All of those things are hugely important, and we can only use those data if enough students are taking the survey through their schools. So it's a tool that we really value highly, and one that requires participation for it to be, otherwise the results, we can't really say they're representative of a state or a region if we don't have enough people taking it.
Awesome. Thank you, Erica. I wanted to just surface one more question here, which is one that I think that there are answers to within the chat too, but just around firearm violence. Jamie asked about statewide initiatives aimed at reducing firearm violence and access for youth. So a few folks shared answers to that. And Jamie, if you wanted to, I know that you shared something in the chat too about a program you're working on. So would you want to unmute yourself, Jamie, and share a little bit about your question and the program? Okay, let me find you here. Okay, great.
Hi, can you hear me?
Yes.
Okay, perfect. Yeah, so I'm the regional health connector in Adams County. I work for Adams County Health Department, and we all do regional projects. And my project is looking at implementing gun locks in primary care offices and doing like a gun screening in the home. So yeah, I was just curious about what kind of statewide initiatives there might be. I do know that I have been hearing from other partners that they are having issues accessing the actual gun locks, like ordering enough or getting enough. Funding is an issue. So it would be great to know if there were statewide initiatives that are happening around gun violence prevention. The ultimate goal would be to get reimbursement from insurance companies for these things for our healthcare providers. So, much like our healthcare providers are doing social needs screenings, something like do you have weapons in the home can be included in a social needs screening easily. And having that gun lock be reimbursed through insurance, maybe starting with Medicaid. I don't know. I know that's a federal question, but that would just be my ultimate end goal of this project that I'm working on. So yeah.
Yeah, really interesting ideas. Thank you for sharing, Jamie. And Erica and Sarah, I saw you had some programs that people might be interested in terms of statewide initiatives around gun violence prevention. Is there anything you'd like to share?
Yeah, and thanks, Jamie, for sharing what you're working on as well. I did mention there's a coalition, the Colorado Coalition Against Gun Violence, and Jamie, and we're happy to connect you with those folks so that you can get connected to that coalition. And then CDPHE is an Office of Gun Violence Prevention, but it sounds like you're working with them already. So those were the two that I mentioned.
Awesome. And Sarah, I have one more question that came up that might be, or Erica, were you going to add something around the gun violence prevention?
Just Jamie had asked about understanding sort of deaths among children in urban settings versus rural settings. So just if anyone else is interested in that, these data come from the CDC Wonder online database. So that's where you can kind of look at data around cause of death for children. I actually don't know the answer on whether it's disaggregated by urban or in rural settings, but I think it's possible because they try to put up lots of levels of disaggregation. So I would just plug the CDC Wonder database. It'll have a lot of this information.
Great. So I'm going to ask Sarah one question while you have your video up that I think you may be able to speak to. OB is wondering if there's data related to kids of families experiencing rent insecurity and evictions. And another housing question that just surfaced earlier was around what it means if children are sharing, or like what crowded housing conditions means. So would you be able to speak to those two pieces, those two housing questions around crowding, and then do we have data on kids of families who are experiencing evictions or trouble paying their rent?
Sure. So I think Erica might have provided a little bit of context around the crowded housing definition, and we're happy to follow up with exactly how that's characterized with folks. In terms of family data around families who might be experiencing evictions, I think in our policy recommendations in that section, I mentioned that something that we're actually recommending is that the state do a better job of collecting data on eviction trends in our state so that we can better understand how those are impacting families. And then I would say, and Erica may have more to add on this as well, but during the pandemic, there was some data being collected on families who were unsure of their ability to pay their rent on time. And we were able to look at some of those data during the pandemic. And so that is something that we were able to see as well.
Yeah, those data that Sarah just mentioned, they come from the Census Bureau's Household Pulse Survey. We wrote about those in our last couple editions of Kids Count, and I'm trying to remember if we have it in this year's, but essentially, yeah, there is a survey question on the Pulse Survey. The Pulse Survey was administered once the pandemic hit. It was a way of gathering data on families at a really rapid pace compared to some of our other national survey tools. And one of the items around financial security was families, confidence in their ability to make their next mortgage or rent payment. So that's one source that we've looked at. I believe the Pulse survey is still going. And so we should sort of pull those data and look at how they've changed over the period of the pandemic.
Okay, great. We're going to just surface one more question. And if you have things that, if there are questions that you haven't asked or things that come up as you read through the report, please feel free to reach out to us. We will share our website on how. And actually, so Cheryl shared a question that I bet will resonate for a lot of folks, which is around how we work to increase wages for teachers. In this presentation, we shared data more around early childhood. And I wonder, Melissa, if you would just share some thoughts on that. And if there are folks in the chat who have ideas for Cheryl, I think that would be great to hear as well.
Yeah, thank you, Jackie. I think I'm going to probably speak to this with my early childhood perspective on, but both Lauren and I are former K through 12 teachers. Lauren has taught kindergarten and preschool, and I taught kindergarten and first grade. And it really is a multi-pronged approach to solving this issue. One critically important piece is narrative change, that teaching is not something, though I know this is very likely not the case for anyone on this call, it's not something that's widely seen as a job that's hard, that requires expertise, that's respected, especially the younger the age of the children that you teach. And that also includes childcare providers who offer care. And to us, care is a prerequisite for education. Care is also a type of education. And we are hoping to work on narrative change to value care differently in our state, to think about what would a reimagined society that valued caregiving look like. It would look like higher pay for caregiving professions from prenatal through end of life, and I include K-12 teachers in my mental list of caregiving professions. But beyond narrative change, we also need new revenue in our state. We know that Colorado has some unique barriers to raising additional new state revenue. And so we're thinking about unique, innovative ways to try to raise revenue for care statewide. I also know there are a number of localities looking at early childhood compensation and better funding early childhood, specifically through special districts or local lodging taxes. And it really does, though, I think, to have success with any of those efforts, require reframing what this job is and why it's important to us.
Thanks, Melissa, and thanks, Cheryl. I think it's such an important question, and one that we can address if we would take some of the steps Melissa was describing. So thank you all so much for joining us here today. I know there's a lot in here that we didn't get a chance to discuss, but I really appreciate the thoughtful questions and all of you being present with us here today for Kids Count. I will make sure that we drop the link in the chat so all of you have access to the report itself. If you are interested in having a presentation on some of this data that is more tailored to your community or certain issues, you can also reach out to us. I included Charlie's contact information here. Charlie coordinates some of those presentations. And when you are on our website, you're going to find a PDF of the report, and you're also going to find ways that you can get in touch with us to request a hard copy of the report if you're interested in that as well. And just as Jamie mentioned, we also will have many hard copies of the report at our event, which is coming up in September. The report is thick this year, and so if you have the ability to come and pick it up in person, we would love to see you at the connection reception. I put that link in the chat early on, and I will drop that in again as we finish up. If you don't already, please subscribe to our newsletters. Kids Flash is regular updates from the Children's Campaign, and we share a lot of resources on all of these issues that we talked about, and you'll find ways to connect with us and learn more about different events and reports that are coming up. And that is our presentation today. So I will take a moment now to drop those links that I mentioned in the chat. And please stay in touch with us. We are so glad that you attended today, and we look forward to hearing from you about your thoughts on this data, questions that you have, and other ways that the Children's Campaign can be helpful to all of you in your work. So stay tuned for these chats. There will be a follow-up email, and I hope everyone has a great day. And we will end the slideshow now.